All right, well, I think we can go ahead and get started, and some additional people will likely be joining us. So good afternoon and welcome. Thank you so much for joining us today. I am Leah Himmer. I'm the secretary of the Colorado Health Ethics Forum Board of Directors, or as we like to say, we usually go by our acronym SHEF. So for those of you who are longtime friends and collaborators, it's really great to see you again. And if this is just your first time joining SHEF, welcome. We are a forum in the state of Colorado that works to bring together diverse voices to engage in the difficult ethical issues of our time, to facilitate ethics discussions and statewide networking for those with an interest and a passion for healthcare ethics. So if you're new, I invite you to go to our website and learn more about us. And for those of you who are old and returning friends, welcome so much. I also just want to say I'm sorry that we weren't able to see everyone this fall for the two-day conference that we originally intended to hold before the situation changed with the Delta variant, which has changed so many of our plans. And it's great that we can still gather together online for discussing these important issues. And then if you're interested in the conference, we did reschedule it for May 3rd and 4th of 2022. So our third reschedule, and fingers crossed that we'll be able to move forward with that this year. So with that, I'd like to welcome you to today's program, Ethics at the Capitol, Health Policy Work. This program will be recorded and posted to our website, and we will invite questions from the audience in the last portion of the program, so please feel free to use the chat function to submit your questions. We have had a last-minute change in moderator. Ms. Allison Neswood is unfortunately no longer able to join us today, but we do have another great and thoughtful moderator filling in who will be introducing your panelists today in just a moment. So with that, I'd like to welcome our moderator, Dr. Carl Middleton, to the program. Dr. Middleton has been a theologian and ethicist in healthcare for 48 years. His experience includes clinical, organizational, and social ethics, including issues involving social determinants of healthcare. He is a past president of SHEF. So thank you, Dr. Middleton, and thank you to Ms. Allison Neswood and Ms. Stephanie Rieger for all the work that they put into organizing this program. And thank you as well to our legislators who took time out of their very busy schedules to join us and tackle these important issues. So thank you so much, Dr. Middleton. Welcome.
Thank you, Leah. And I'm honored and delighted to serve as your moderator this afternoon. So thank you. Just to set the stage for our great discussion this afternoon, in recent years, Colorado has passed several big healthcare bills aimed at improving the availability and affordability of healthcare and advancing healthcare equity. From reducing the cost of prescription drugs and hospital care, to improving the quality and cost of health insurance, to address racial inequities in maternal and infant health. State legislators take an aim at some of the most persistent problems in healthcare. Today, we are honored to have three outstanding legislators who have been deeply engaged in some of our state's biggest healthcare debates as they discuss Colorado's health policy landscape and how ethics might inform healthcare decision-making at our state legislature. Today, we have our legislator panelists, Representative Chris Kennedy, Representative Julia Mccluskey, and Representative Iman Jodeh. And I will share each of their bios with you individually, and there's a pre-assigned question. So I will share the bio and give that person their individualized question. So first up is Representative Chris Kennedy. Representative Kennedy is a third-term state representative for House District 23. He currently serves as chair of the State Civic, Military, and Veteran Affairs Committee and a member of the Health and Insurance Committee. Over the last 5 sessions, his legislative accomplishments include more robust cost transparency requirements for hospitals, a reinsurance program to reduce health insurance premiums on the individual market, a prescription drug affordability board, stronger consumer protections at freestanding emergency departments, increased supports for renters and utility customers, improved prevention and treatment for substance abuse disorders, initiatives to combat climate change, and multiple innovative democracy reforms. He has also supported increasing funding for K-12 and higher education, transportation infrastructure, affordable housing, and behavioral health care. Chris's priority is to make sure every hardworking Coloradan has the opportunity to thrive and enjoy a unique quality of life. With the rapid growth we've been experiencing, he is committed to addressing the high cost of living, including healthcare, childcare, housing, and higher education, and to protecting our clean air and water and our most beautiful public lands for the next generation. Prior to entering public service, Representative Kennedy was a structural engineer. He has been an active volunteer for local campaigns and environmental initiatives, and has served as an aide and policy staffer for 4 sessions and manager of numerous campaigns in Jeffco. I'm wondering, as I read this, does he ever sleep? So Chris is a lifelong Coloradan and has a master's and bachelor's degree from the University of Colorado. He lives in Lakewood with his wife, Kira, their daughter, Lennon, and 2 dogs, 2 cats, 2 goats, and 3 chickens. And so, Representative Kennedy, here's your question. Over the last few years, the state legislature has passed a number of big health policy initiatives. Can you start by providing an overview of some of the major issues that the legislature has been working on to improve health in Colorado? And welcome, Representative Kennedy.
Thank you so much. I probably would have submitted a shorter bio had I realized we were reading it out loud. Sorry about that, but thank you. Lennon here is having a little bit of a fussy moment, but I think she quieted down just in time. So happy to start talking about what we've been working on over the last several years. So, we've made progress on really all aspects of healthcare, whether that's expanding access to different kinds of care where people were underserved, whether it's investments in public health. And a place where I've focused a lot of my energy is on healthcare reforms that bring down the cost and attempt to shift the way we pay for healthcare in this state. So I've been in the legislature for 5 years. I know that a lot of this work started way earlier than that, and we've kind of just picked up where our predecessors have left off. But I can say we've done a lot of work to expand access to reproductive health care in this state. We've made it harder for kids to access tobacco and marijuana products. We've removed a lot of barriers that make it harder for parents to vaccinate their kids, which sometimes is the barrier. And that was even before the COVID-19 pandemic and the vaccine controversy that we're dealing with more recently. Of course, during this pandemic, we made a number of emergency policies, some of which were through the governor's office, some of which were through the legislature to help people get through the COVID-19 pandemic, whether that's providing testing kits or making sure vaccines are distributed equitably. We've made major investments in reforming our behavioral health system that have started with the launching of a behavioral health administration and starting to invest in a major care coordination system. And I think you're going to see a lot more where that came from next session, because we've had an interim committee meeting to look at how to spend some of our federal dollars on behavioral health, not renovations, but reforms. I've worked on the opioid interim committee for the last few years, and with my colleagues that are on that committee, we have made significant investments in prevention, harm reduction, treatment, and recovery for opioids and other substance use disorders. In the healthcare reform and cost space, we've put in place new transparency requirements for hospitals, including how they spend their community benefit dollars. It was not all that long ago that we made the hospital provider fee into an enterprise that secured Colorado's Medicaid expansion, which has been tremendous in terms of making sure that a lot of people who need help the most are getting it. We've put in place new regulations on freestanding emergency departments. We've worked on out-of-network surprise billing We've worked on establishing a reinsurance program in Colorado, which I know Representative McCluskie is going to talk about. We've done a couple big things on prescription drug costs, including allowing importations from Canada and other countries, and establishing a prescription drug affordability board that is going to be starting up soon to establish upper payment limits on some of the highest cost drugs where the R&D investments cannot justify the cost that's being charged to Colorado. Just this last year, we passed a public option in Colorado that is going to create a new healthcare plan that is regulated in a different way from what's on the traditional market. We've put in place a framework for purchasing alliances. We've put in place a primary care payment reform collaborative that's starting to look at really innovative payment designs for primary care. And we've required hospitals to improve their financial assistance programs for indigent patients. And last but not least, because I know that the conversation around social determinants of healthcare is incredibly important, I don't have an exhaustive list of what we've done, but there is a broad recognition in the legislature that if people aren't getting affordable housing, if people can't get nutritious food, if people don't have good jobs or good educational opportunities, their health is going to suffer as a consequence. And we have made significant investments in all of those categories, both during the pandemic, but also for the longer term. So I couldn't be more proud of the stuff that we've been doing. And yet it's sometimes terrifying how far we still have to go.
Well, thank you for your outstanding work in this regard. The reason we wanted to share your bios in depth with people is so they get to know you, and particularly about all the great work that each of you are doing. And so now we'll move on to Representative Julia Mccluskey. Representative Mccluskey is a state representative for House District 61, which includes counties in Colorado's Rocky Mountains and along the Western Slope. In her first session, she was appointed to serve on the Rural Affairs and Agriculture, Education, and Appropriations Committees. Over the 2019 to 2020 fiscal year, she was selected chair of both the School Finance Interim and Appropriations Committee. Most notably, she was honored to receive an appointment to the prestigious 6-person Joint Budget Committee in January of 2020. Among her legislative accomplishments of this session are passing the statewide reinsurance program and several education bills. Senator McCluskey is particularly passionate about public education, having worked for more than a dozen years in communication, community engagement, and student behavioral mental health initiatives for the Summit School District. Currently, Representative McCluskey currently serves as board member on the Summit Foundation, helping to support working families in Summit County and neighboring communities. She served as a board member for Advocates for Victims of Assault in Summit County and served as an advisory board member for Building Hope Summit County, a community initiative to improve and increase access to mental health services, and as a key leader on Communities That Care, an effort to prevent youth substance abuse use. She was a member of the Colorado Educator Preparation Innovation Coalition, which addressed teacher shortages and improved preparation programs across the state. Born and raised in Colorado and a graduate of Colorado State University, Julie and her husband Jamie have spent most of their married lives in the Rocky Mountains. They are proud parents of 2 children, Ian and Kate, and enjoy spending family time in Colorado's great outdoors. And so, Representative McCluskie, here's your question. Can you talk about the importance of health legislation in the rural and resort areas of our state? And welcome, Representative McCluskie.
Thank you so much, Carl. And I want to just add something not included in my bio. I have 6 chickens, so I beat Representative Kennedy by 3. And I want to thank you all for inviting me to be here today to talk about issues around healthcare that I am certainly so concerned and passionate about. My colleagues, Representative Kennedy and Representative Jodeh, are 2 strong voices for healthcare reform, and certainly for the people that have been continue to be impacted by the lack of access to affordable, high-quality healthcare in the areas where they live. And my question is about the rural and rural resort experience in healthcare. And for those of you a part of today's conversation who may be familiar with some of our challenges, they are unique. You know, hospitals in rural settings, whether you're looking at the Eastern Plains or Western Slope, often lack the same high quality facilities, equipment, and personnel expertise that can be found more readily along the Front Range. Additionally, smaller rural communities often have no access to healthcare services, primary care, dental care, and certainly specialty care. When I first ran for office and launched my campaign in 2017, I spent a lot of time on the doorsteps talking to families who were so very frustrated. While we sometimes make trade-offs in rural Colorado, recognizing we may have to travel a great distance to find healthcare services, the costs of what we are paying to get health insurance for our family, or even to secure those services, healthcare services, had become literally far more than a mortgage, far more than what we were paying for childcare. As a matter of fact, counties on the Western Slope have been paying some of the highest health insurance premium rates of the entire country. And in 2019, my very first session, we were fortunate to bring forward the first version of the reinsurance program that helped bring down health insurance premiums in the individual marketplace significantly, roughly 30%. This year, we are seeing a 36.5% decrease in health insurance premiums on the Western Slope specifically, roughly a 24% decrease for folks statewide, an average number statewide. And I'm really proud of that work because we know so many people have gone without health insurance because of the rising costs. In Summit County, a rural resort community, we often talk about the three legs of the stool for any one person or family to really make it in our resort country. And that is that they need a job that pays a living wage. They certainly need access to affordable health care, and then child care, being able to provide care for their family so they can continue to work. And I think, you know, with healthcare costs that have been through the roof, with the challenges in finding available, let alone affordable childcare, and then jobs that, you know, because we are such a high tourism economy, so many entry-level service level jobs that pay at the lower end of the pay scale, our minimum wage, not all that much higher than what you see down here in Denver. You know, people have really struggled to make ends meet. So, you know, in that rural setting, I think we've also brought some legislation as a body that has addressed some of the other challenges we face in healthcare, and I'll be quick to wrap up my 5 minutes. We brought forward a bill that has allowed us to form a healthcare cooperative, the Peak Health Alliance, that has helped us leverage some of our buying power in rural parts of the state. Last year, I was very proud to bring forward a bill with Dr. Yadira Caraveo that expanded access for victims of rape and incest to healthcare, reproductive healthcare in rural settings. Victims of rape and incest, particularly those on Medicaid, were traveling all the way to Denver for that care. And we have now expanded some of our facility definitions to make sure individuals can get that care where they live. We're also focused on the Colorado option. I can't celebrate Rep. Jodeh enough, and I know she'll talk about that significant accomplishment last year. But the Colorado option is really helping us drive more competition into rural parts of the state, which we know will help bring down the price tag. So again, thank you all for having a focus on healthcare equity, your compassion, commitment to making sure that underrepresented communities have access to the same high level of healthcare is critical. And I am so proud to be here today and hope that we can continue to partner on some of those healthcare challenges we are facing in our great state. So thank you.
And thank you for all the excellent work you're doing in tackling some very tough issues, you and your representative colleagues. Now, Representative Iman Jodeh. Representative Jodeh is the representative for House District 41 in Aurora, Colorado. As a first-generation American born to Palestinian immigrants and refugees, she has called Colorado, specifically House District 41, home her entire life. As the first Muslim and Arab woman elected to the Colorado State Legislature, she is passionate about social justice work and advocates for criminal justice reform, fighting the rising costs of and increasing access to health care, increasing access to jobs and education, ensuring equal rights for all, and combating our climate crisis. Iman is the founder and executive director of the locally based nonprofit Meet the Middle East, which fosters relationships between the United States and the Middle East through education and immersion travel. As the first female spokesperson for the Colorado Muslim Society, the largest and oldest mosque in the Rocky Mountain region, Iman also plays a major role in representing the Muslim community on a variety of social justice issues statewide. She is the former community advocate and liaison at the Interfaith Alliance of Colorado, where she spent many years on the front lines during the Colorado legislative sessions fighting for progressive legislation. She is also a proud board member at Ready to Work Aurora and board member emeritus at the Village Exchange Center and Women's Lobby of Colorado. She has lectured at the University of Denver. In 2006, she received her master's degree in public policy from the University of Colorado at Denver. Iman is fluent in Arabic and maintains a second home in Ramallah, Palestine. In her free time, she enjoys cooking, spending time with her large family, and fly fishing in the beautiful rivers of Colorado. And welcome, Representative Jodeh. Your question is, you and many of your colleagues, particularly leaders in the Black and Latino caucuses, have done important work to elevate the focus on racial health inequities. Can you talk about why this is important and how this focus has been incorporated into health legislation at the Capitol? And welcome.
Thank you. So my name is Iman Jodeh, and it is an honor to be here today. I am in awe of my colleagues, Representative Kennedy and Mccluskie. They are not only mentors, but what I aspire to be once I get to where they are. You know, being an adopted member of the Black Caucus has allowed me to elevate the needs of Black and Brown people, especially in healthcare. The reality is that Black, Brown, and Indigenous communities are often, if not always, marginalized when it comes to healthcare access. During the hard work of passing the Colorado option, in conjunction with Representative Roberts, we really needed to make sure that Black, Brown, and Indigenous communities were represented in this bill. The things that we're seeing in these communities is, in fact, not having access to primary care, not having access to preventative care. And that isn't just, you know, general care, it's mental health, it's eyes and vision, it's vision and dental. And so the other thing that we were noticing is that a lot of these communities were using the emergency room for primary care. And we needed to curb this, this reality and this trend to, again, make sure that they had access to equitable, sustainable, and quality healthcare. Something that in my mind really wasn't afforded to them. And it was simply because many of our communities are not taken into consideration when establishing or giving care. And I can give you an example. I was consulting with Children's Hospital, and they were having a hard time providing care for immigrant refugee communities, especially the Muslim community. And so really having a cultural awareness and having that fluency in what to expect with these communities really looked like, you know, it could be so little as, you know, if a Muslim woman comes in and she, you know, comes from a country that doesn't really provide healthcare services as well as we do here, even though we still have a lot of work to do, understanding that depending on her level of religiosity, she can't be in a room alone with a man, right? And so simply leaving the door open or allowing someone of the same sex to come in and be present increases folks' level of comfortable, you know, comfort going to the doctor, seeking care. And also another big thing about the Colorado option was making sure that we were taking active steps to have providers look like the communities that they were serving, and ensuring that the Colorado option could allow them to stay in the communities that they were serving, so that there wasn't a medical desert in their communities. And a big reason for that was not only did they look like them, but potentially speak their language, share their religion, or were fluent in their cultural needs and traditions. And so that's a really big thing. But the other thing that we're noticing is that basic services like access to the vaccine, like Rep. Kennedy mentioned, was BIPOC communities were overrepresented in their ability not to get the vaccine. And so the Black and Brown caucuses the Black and Hispanic caucus really made an effort to work with the governor's office to make sure that our communities were covered. We had health clinics and vaccine clinics in places of worship that allowed folks to be in a place that they were comfortable with. You know, and I'll end my 5 minutes if I haven't gone over already. With the bill that Rep. Kennedy mentioned was, you know, passing the healthcare bill for indigent patients. And so that bill essentially protects patients to make sure that hospitals cannot overcharge uninsured people and assist them in avoiding collections. And so hospitals will have to screen for financial assistance and public coverage. And then finally, it increases accessibility of information, right? So Coloradans will get the information they need in their preferred language, which again speaks to that cultural competency that we need in healthcare. Much more to say, but I will save that till later. So yeah, thank you for this time.
You're most welcome, and what an impressive amount of work that you all are doing, and the compassion and care and concern for particularly the vulnerable and poor persons and those that suffer from health inequities. So thank you for all the work that you're doing. Now, the next question, which is for all three of you, and which would be a 3-minute time limit. But by the way, I have to applaud you. All of you were underneath the 5-minute mark. So fantastic, great. So 3 minutes this time. Can each of you identify a couple health policy issues you think will be on the agenda for the legislative session that will start in January? If you want, feel free to note policy initiatives that don't have to do specifically with healthcare, given the recognition that social determinants of health, like housing, transportation, and meaningful employment opportunities, have the greatest impact on health. And so who would like to go first? Representative McCluskie.
Well, thank you, Carl. I think there is a lot brewing for this next legislative session. And let me highlight that the state received $3.8 billion in federal funding last spring to help us recover from the impacts of COVID and certainly serve the most vulnerable Coloradans and support them through this time. I think the legislature very wisely put aside a lot of that money to focus in on three significant areas: affordable housing, behavioral mental health, as well as economic recovery and relief programs that again really are a part of that social safety net. I think behavioral mental health efforts will be significant this year. I am currently working on legislation around involuntary holds. We have a moment to think differently about the entire behavioral mental health system with the formation of the BHA. And I think we're taking on some big policy concerns that have been brewing out there with our friends and partners and advocates for years. That just being one example. I also believe that healthcare workforce needs will be top of mind for many of us. I'm working on a rural preceptor bill. A preceptor program allows healthcare professional students who are studying to get their licenses to work alongside a healthcare professional in a rural setting with the hopes that they find our lifestyle so charming they choose to relocate to a rural healthcare setting once they are a graduate and licensed in their particular field. So I think that's, again, another example, but I think healthcare workforce will be top of mind for many of the legislators this year.
Okay. Who would like to go next? Okay, Representative Jodeh.
Thank you. So a few things. I completely agree with Rep. Mcclusky. For me, healthcare will always be a priority. Having experienced our healthcare system like almost every Coloradan, and for me in a very difficult way. I live with epilepsy, and so not having care or access to medication that I need every day made it difficult in the beginning, right, to receive care. And just like I said before, allow my parents to feel empowered to take care of their child, but not having access to that cultural competency part, right? I watched my dad, suffer from cancer for 6 years, and the last year of his life, I received a summary of care bill for $1 million. And I can't imagine what folks who don't have assistance or healthcare would do. And this speaks to exactly what Rep. Mcclusky was saying, right? None of these things live in a silo. If folks don't have affordable housing, right, that means they are having to choose between groceries or rent or paying their mortgage or anything that they have, right? And the reality is also that nationwide, 21%, and that may not seem like a lot, but it is, have shown that they have to significantly change their lifestyle to pay for medical bills. And listen, the statistics go on and on, right? And we're aware of these statistics, but because none of these issues live in a silo, as I was saying, affordable housing for lower socioeconomic classes usually live next to high polluters. If we have high polluters, that's affecting their health, which is also affecting our climate. And so it's this whole, unfortunate ecosystem that build on the other and puts pressure on our healthcare system. But if our healthcare system is not sustainable or giving quality healthcare, then we're not addressing any of these issues. So as legislators, when we go in and start thinking about which bills we want to work on each session, in my mind, I work on these bills not because they're issues, but because we need to solve them, and they are our basic human rights. And so, Rep. McCluskey's right. We have all of these bills, whether they are specifically focused on healthcare, they're all affecting healthcare in general, and Coloradans' ability to stay healthy, to be proactive on their health, and understanding that things like access to affordable prescriptions and access to mental health providers tend to go very much unnoticed. And so addressing these two issues, especially, for myself, is also a priority. The last thing I'll say about mental health is that I think, folks like Daphne Michelson Janae and, are making this a priority. Rep. Amabile, who have lived experiences in these areas, bring that advocacy and that lens to the legislature to make sure that the policy we're passing really reflects the need of our community, and we're not bypassing it or putting it on the back burner, especially when we know that Colorado has the highest rate of suicide among young men. So again, I think if we can address things like this from the legislature while working with the community through our lived experiences, we're only creating quality quality policy that gets at the root of each of these issues.
Great, thank you so much, Representative Kennedy.
So, I mean, as you can tell from what my colleagues have said, there's a ton going on. I mean, these opportunities to invest federal dollars in transformational change on housing and homelessness, as well as on behavioral health, are going to be some of the biggest things you guys are going to hear about this session. I think that there's going to be a continued focus on reproductive health care after what happened in Texas and the potential Supreme Court action. We're double checking a lot of our laws to make sure that the protections remain in place. I think, this is not the first time we've done this exercise, but there are discussions about making sure that what we've got is bulletproof, because we really believe strongly in making sure that reproductive health is available to every Coloradan. I think that I will touch on just a couple kind of innovative things out there that are happening, because these are kind of the things that get me excited about healthcare. And it's strange, but a lot of it has to do with IT, and a lot of it has to do with care coordination. So there are a couple proposals that the governor's office has put into their budget request that I think are very, very exciting. There are budget requests both for healthcare policy and finance and the Division of Insurance related to alternative payment methodologies. For the one for healthcare policy and finance, it's a pretty big reform in the Medicaid system that's going to attempt to help direct patients to the highest value care, as well as trying to implement bundled payment models within certain kinds of episodes of care. Maternal health is an example. There are many others in hospital care. And I think these kinds of things are big steps forward in paying for value instead of paying fee for service. There's a similar effort that the Division of Insurance is pursuing about trying to do similar things with alternative payment methodologies in the commercial insurance sector. It's a little bit more of a carrot than a stick at this point, kind of trying to create some incentives and technical guidance to help this happen. But you now couple that with one of the proposals that the governor submitted to the Behavioral Health Committee, and we have something very big. He's proposing major incentives, both to providers and to payers, to transform their systems. And I think these things can really move the ball forward quite a bit. The last thing I want to touch on is there are a group of very, very smart people out there working on something that they call collaborative community response, which is attempting to break down some of the barriers we have, not only between physical and behavioral health care, but bringing in public health, bringing in county human services and all the kinds of programs they offer, and bringing in local community leadership. So you have kind of these 5 pillars that would all work together on outcome-driven healthcare policy, where we try to coordinate care for people, not just within the healthcare system, but between all these public benefits that we offer. It's pretty innovative. It has to do with creating an independent care coordinator, which they refer to as the Commons, that is pretty new and somewhat disruptive to existing systems in healthcare. but it also is building on a lot of the work that the Office of eHealth Innovation, one of my favorite acronyms because it's OHI, is working on in the governor's office. So creating these interoperable systems where all these different partners can work together off of the same file for a patient, so that when a doctor refers someone to get food assistance through their local county human services, they're looking at the same record and they know exactly what the doctor said about why, and then the doctor will get feedback about what services they receive. So this is a very forward-looking thing. This is probably the kind of thing that takes 10 years to really even get off the ground, but I'm excited by it, and I'd like to see us take some first steps this year.
You know, it's been impressive to hear you as your dedication, your passion and commitment to help resolving the problems that impact people throughout the state, and particularly the high cost of healthcare and the high cost of being ill or sick. So you're to be commended for your commitment and dedication. I want to frame the next question. I'd like to lift up a definition and develop a concept to frame that next question. Healthcare ethics is concerned with the vast array of moral decision-making situations that arise in the practice of medicine, in addition to the procedures and policies that are designed to guide such practice. Not only are bacteria and viruses like COVID of concern in the practice of healthcare, so too are cultural, social, economic, educational, and legislative factors, to the extent that they have an impact on the health status of people in our society, which you've identified sufficiently in the projects that you're working on. For this reason, healthcare workers not only include professional clinicians, but also social workers, members of the clergy, chaplains, medical facility volunteers, employers, educators, legislators, and others. So we need you. The Colorado Healthcare Ethics Forum facilitates opportunities for collaboration and networking among persons and organizations engaged in healthcare ethics across Colorado, is wondering what the opportunities are to engage state legislators in this dialogue. And by the way, the CHEF has been in existence since 1999. So in this session, we're going to look at, all three of you have 5 minutes each. We'll start with Representative Jodeh, then going to Representative McCluskey, and then to Representative Kennedy. And the question is, can each of you speak to how expertise in healthcare ethics might be able to inform strong policy in your priority areas as a state legislator? And so, Representative Jodeh.
Yeah, thanks for the question. And I think it's super important to address and actually reiterate this point. And I will say that I'm sure my more seasoned colleagues can give more of an in-depth answer. But for me, what I've learned is that as a legislator, I depend on that expertise. I depend on that, that lens to help me craft legislation that I know, one, needs to happen, but two, I'm getting expert advice and guidance from experts in the field. And so when they are on the front lines practicing the policies that need to be implemented, they know how to craft this in a way that will be most effective, most efficient, and will be, well, in my mind, move Colorado forward in a progressive manner that helps us honor our belief that healthcare is a human right. And listen, I think we can all agree, and it's been said already, you know, healthcare reform and really molding it to the way we want to see it for future generations, knowing that, you know, previous practices and in the sense of the traditional term that of what healthcare was isn't working, that we need to really reimagine what that is. And so again, in my own practice as a legislator, I really make it a point to reach out to these folks or take those meetings when they are requested. That's how I educate myself. That's how I continue to become more aware of issues that maybe aren't so obvious as a consumer, but when they are providing a service, it gives us, again, a different lens for behind the scenes. And it's not always as smooth running as we think it is. There's always that boat that looks, nice and easy on the top of the water, but there's a lot of paddling underneath. And so sometimes if we can make that paddling less frantic, that's what I hope to do in the legislature.
Great, thank you. And Representative Kennedy.
I believe you originally said Mccluskey was going to go first. I don't know if she had a preference about that. Yeah, please.
Happy to jump in while you deal with baby Lennon. It is such a good question, and I love the framing, how you talk about all the different players that really come into ultimately what is our healthcare system, and literally it is everyone. Thank you so much, Rep. Jodeh, for acknowledging that healthcare should be a human right. It is a human right. And I think the one thing I was very excited about in participating today, I took a moment to go look at the Colorado Health Ethics Forum website and was really excited to see your core values align with many of my colleagues, those of us that serve in the House and the Senate, who are focused like you on collaboration, diversity, wisdom, justice, and compassion. And I think, connecting with legislators and being able to move policy change forward, while it may feel daunting, the door that we have opened today for one another, spending a little bit of time listening to one another is certainly that first step. I would lift up someone who is on this Zoom event today, Don Parsons, who is the person who reached out to me and said, hey, would you come join our group and chat with us? He has been an individual who frequently will send me that email, place a phone call, find me at an event to share either a story about some of the challenges that are happening locally with healthcare services in our community, or to share new and novel ideas or learnings that he has had. And all of you on this call, obviously this is an important priority for you. I think as legislators, we hear so often from our constituents about the need for more affordable healthcare, more accessible, more high quality healthcare. We don't always know every partner or person to have with us on that journey to be talking about those policy solutions. And I know, at least for those of us in the House, the three of us here on the call today, we've all provided our contact information. I really think the opportunity to engage with a state legislator begins with a conversation, and that conversation can happen in so many different ways. So please reach out. I certainly welcome that. I know Rep. Jodeh and Rep. Kennedy do, but I believe if we were to while we have made very significant reforms in the state, the many that Representative Kennedy really launched this conversation with, I think there is, as he said, so much more work to do. And being able to count on support and conversation from leaders like yourself is an important part of getting those bigger, better reforms accomplished. So thank you, Carl, for the question. It's a big one.
And thank you for your response. And now Representative Kennedy and Lennon.
Yeah, Lennon has lots of things to say about this.
Sure.
I did a lot of Googling to find out what exactly you guys were intending with ethics in healthcare policy, because, I've read about ethics in medicine and how providers may think about some of the decisions they make. Ethics in healthcare policy is maybe kind of a different animal, but, and so I'm not entirely certain I'm getting at what you intend here, but I will say that there are certainly a lot of competing priorities. A great example of this is cost versus quality versus access in healthcare. And so, you know, there's a real risk if we put all of our emphasis on reducing the high cost of healthcare, then is there a risk that we do that in such a way that it hurts people, hurts their outcomes? And the opposite is true. If we put all of our emphasis on access without thinking about the cost, are we going to create an access problem because of the high cost? And so these are things that are a really challenging balancing act. And I think all we can do there, you know, there's never a perfect answer or a right answer necessarily. I think you just have to evaluate the conditions on the ground and try to decide what's going to make the most sense in any given case. You know, another one I read about when I was researching this is thinking about autonomy versus beneficence. And the idea, so, you know, I couldn't help but thinking about vaccines and vaccine mandates as a, you know, we have not mandated vaccines in Colorado except in certain kinds of work environments. And yet what we're seeing is because autonomy was prioritized in some ways, in that people get to make these decisions for themselves and their own families, we still have such a high unvaccinated population that the Delta variant just ripped right through Colorado. And the hospitalization rates we're seeing right now are, I mean, I think I saw that we're going to surpass the 2020 peak. I mean, that's terrifying. I think everyone in the state was hoping we were going to get to a place where by now we were getting back to normal and looking forward to these big Thanksgiving gatherings. And now we're wearing masks again at indoor locations. And so it begs what I see as a very interesting question, which is, you know, healthcare is traditionally seen as every individual's choice. And that's an important value for a lot of reasons. I mean, comparing it to abortion is a good example. I have consistently said, I'm not, as a policymaker, going to stand between a woman and her doctor when it comes to making some of those tough decisions. And yet, when it comes to vaccines, honestly, I'm rethinking it. I am giving serious consideration to whether the public health benefit of getting a pandemic under control by increasing the vaccination rate is a higher value than autonomy. And I have not landed on it. I will admit it is a very difficult question that, I mean, I expect we'll probably still be grappling with for years into the future.
And it's interesting that you just say that, because yesterday I was at a meeting and where it was told that we had, as of yesterday morning, just 94 ICU beds available in the whole state. So, you know, because of, and mostly it's because of unvaccinated people. And so at least, so you make some very excellent points. Let me at this time open it up for questions from the audience, and you can use the chat box to submit your questions. And until we generate some questions, if you all have a response to each other, please feel free to add or
I do see one question in the chat already. Jonathan asks, please contrast incremental change and more inclusive change in healthcare policy and finance. We talk about this all the time. You know, we run these big bills that, you know, with the bigger the legislation, the bigger the unknowns in a lot of cases. And so, you know, I've always been for big change. I think a lot of times I'm comfortable diving into something, even if there may be some risks of some unknowns, knowing that we may be able to come back and clean it up afterwards. But that's not always the case. So a lot of times, even the increments are very large because the problems are so large. And so, you know, I look back at what we've done in 5 years, and it's not like we're closer to Medicare for all in Colorado, but the things we've done have had a dramatic effect on people's lives.
I think I will just add that, you know, Rep. Kennedy nailed it on the head, right? For example, we passed the Colorado option. It was a gargantuan bill that took 3 years. But once it's put into practice, right, we are going to learn things that need to change, that we're seeing a need in the community that wasn't covered or can be changed by simply amending the bill. And there's a very good chance, right, we will, right, all of the healthcare bills that come will supplement those needs and will start to fill the void of other places and other services. And honestly, my mind is quite simple. If it will take an act of Congress to get where we need to be. But in the meantime, if Colorado can pass inclusive legislation that isn't centered around one group or groups that have, more access to healthcare, and I want to stress here that it is not just BIPOC communities. Rep. Mccluskie had a great point. The fact that folks on the Western Slope have a higher deductible than their mortgage makes it difficult to, again, have sustainable, equitable, and inclusionary healthcare. So when we have these roadblocks, even when we pass legislation, again, we realize as legislators, there may be fixes, and we have to go back and do that so it can always progress and get to the point where it is the most efficient and it's working the way we really want.
I would just add, I think there has been a gift in that the Democrats have had control of the House, the Senate, and the governor's seat. It has been a privilege to be able to think bigger and more boldly with some of our healthcare reforms. And while I think with great wisdom and patience, the public option is an excellent example of a bill that was lofty, had big ambition. And after going through the legislative process and after listening to many advocates and stakeholders, the bill turned out to be something different. It was maybe still a bold idea and accomplishment, but a more incremental step forward in that complete revolution that we need in the healthcare system. But I think it's that we have set these big, bold goals, that we've had the advantage of being able to move the two chambers as well as the executive branch in the same direction. And I think that is what is allowing us to think more inclusively and equitably about the work that we are doing and what we're trying to accomplish. And ultimately, because we've set out these goals and with these very broad, big visions, I think people, particularly in the healthcare space, are very clear on what our ultimate goals are, on eliminating healthcare disparities, making sure that all people from all walks of life in all parts of the state have access to that high quality healthcare.
We have another question. Do any of the panel participants, all of a sudden the question just disappeared. Let me get it back. Do any of the panel participants have some ideas for incentives that might increase our vaccination rate? For example, should state policy require vaccination for admission to sporting events, restaurants, plays, and concerts? So who would like to tackle that one? Representative McCluskey.
Let me just jump in with one that the governor's office has been working on. Some of you may be aware, our community colleges were giving scholarship opportunities to students if they got vaccinated. The governor had given a couple $1 million out as a part of a drawing, a lottery to those who received their vaccination. I think the governor's office is now thinking a little bit differently around some incentives, and one that I'm really impressed with is giving incentives to primary care providers for particularly vaccinations in the 5 to 11-year-old space for our children, because we need to shift this conversation away from government. I think that's been part of the problem with why vaccinations and getting a vaccination there's been so much pushback. I think there's just been a lack of trust. And by motivating, and not that our doctors aren't already motivated, they are good people fighting the good fight, but with additional cash, maybe they can finance better outreach, better promotions, better communication and education around the value of vaccinations. And I'm kind of excited to see where that leads by incentivizing our medical professionals instead of the actual recipients of the vaccine.
Great, thank you. We have another one. Thanks to all three of you for your significant positive work for Coloradans and for joining us today. You've landed on many of the insights we in the healthcare ethics community have grappled with for many years. I'm interested in your experience with implementation of and accountability for legislative requirements such as social determinant screening in Colorado hospitals. It has been my experience that the reality on the ground does not match the goals of such crucial social justice healthcare laws. Could you comment? Representative Kennedy.
Thank you. I might have a little bit of background noise for this moment. You know, one of the things that I've worked on with Allison Nestwood, actually, who was originally going to be our moderator, was a bill a couple years ago about how hospitals spend their community benefit dollars. And this doesn't get quite at the screening question, but I think it gets at the same other thing, which is the nonprofit hospitals in Colorado, in order to maintain their nonprofit status, are supposed to be investing considerable resources in various things that meet the needs based on a community needs assessment. And sometimes that's supposed to be behavioral health, but could also be inclusive of investing in affordable housing. There have been some questions. I think a lot of hospitals have started tallying up their Medicaid under reimbursement and calling that a community benefit, which I understand that that's a challenging thing for them to account for sometimes, but it's not the same thing. And so the Department of Healthcare Policy and Financing has put out the first report. There will be another one, I believe, in January, looking at exactly where hospitals are spending these dollars. And I think that'll help us decide whether there's more we need to be doing there to push those kinds of investments from the hospitals in the state.
Representative McCluskie or Representative Jodeh, if you have any comments? We have another question. There is a cost to an uncontrolled.
I think Rep. Kennedy got it.
Okay. Representative Jodeh, did you want to say something? Okay. There is a cost to an uncontrolled epidemic, including the COVID pandemic, as well as an uncontrolled marijuana market, both of which drive more people to ERs and hospitalization. What role does the government have to regulate and mandate?
I'm happy to take a stab at this one. I've worked on a few marijuana policies over the years. We have a highly regulated market. It doesn't mean it's perfect, but I think that the state government as well as local governments have a very, very significant role in making sure we're keeping marijuana out of the hands of kids and shutting down the black market so that cartels aren't still profiting off of its distribution out there. There were some questions that arose over the last few years about teen use of certain products. There was a major piece of legislation this session that had some controversy in it. I actually ultimately voted against the bill because of some concerns I had, but I was a very small minority. Otherwise, it had very strong bipartisan success because the concern is so great for making sure that kids are not accessing marijuana products. So it's something we're going to have to continue to monitor. But I would say that, yeah, we have a very, very significant role. Amendment 64 gave us that role when they said we're going to regulate this rather than just prohibit it because prohibition was seen to be a failed policy. I tend to agree, and I think we're doing a reasonably good job, but there's always more work to do. You know, Representative McCluskie mentioned earlier that she works on communities that care, and that's a perfect example of an evidence-based prevention education program. There are a lot of programs like the ones I went through when I was in elementary school, DARE, that were not particularly evidence-based and didn't really do the job, but programs like Communities That Care can really make a huge difference in helping kids make good choices when it comes to drugs and helping avoid some of the problems that we're seeing. So investing more in that kind of prevention infrastructure is a very high priority.
Great, thank you so much. Representative McCluskey, would you like to comment, or Representative Jodeh?
I would like to add, you know, I think this is an ethical dilemma that we face often, not only in this space, but in other space. You know, the role of regulation and mandates and the tension that exists with government regulation and personal freedoms. You know, the vaccine challenge and conversation is daunting. My inbox is full of emails from individuals in my district who feel that any sort of government mandate, mask wearing, you know, requiring vaccinations for employment far exceeds government's authority and role in our lives. And while I think the conversation is a fair one, I also think the unprecedented nature of a pandemic and the challenges that we are facing, and I think government's role in thinking of and supporting the greater good, the broad society, you know, all of us, not just some of us, requires us to think about some of those very, very difficult and tough decisions that some people view as impositions on their personal freedoms, when some of us view those same steps and measures as ways that we are protecting one another from fatal harm and this disease. So it is a tough one. I think that, again, as we were talking earlier about engaging with the legislature, you know, I am always so grateful to hear the voices of people from my district, particularly on some of these tougher issues. I do think we have a responsibility, and I'm proud of how the legislature has responded to the pandemic and has legislated in a way that I think has protected the good people of our state, the men, women, and children that all want to get life back to normal. And I think a lot of our decisions have helped foster that sense of normalcy and that hope that we will be able to return to life as somewhat normal. I guess there never will be the old normal, just the new normal.
I apologize. I'm out of time and I'm going to log off here, but it's been lovely. Thank you all so much.
Well, thank you so much. I don't see as we having, I don't see any more questions. So let me just say, it's very interesting that our core values, as Malia shared, summarized our mission statement in the beginning. I'd like to share that our core values for Chef are collaboration, concern for diversity, wisdom, justice, and compassion. And I'm so impressed today that all three of you demonstrated these core values in action and concern, and applying these in the state legislature arena. I've been most impressed with your compassion, your passion and commitment, and dealing with very substantive, complex, structural kinds of issues in our society. And you're to be commended for taking them on. And so we're so thankful to you and taking the time out of your busy schedules to be with us today and to share. And don't forget, if we at Chef can assist you in any way, or with helping you do some of that ethics research and stuff, we will be happy to do that. And I just want to say thank you for the participants and your questions. And don't forget Chef's annual ethics conference, May 3rd and 4th. And we pray that we can do that in person rather than virtual. And so I say again, thank you to our legislators, and have a great evening, everybody. Blessings.